Hi everyone, this is Linda Zinski, human biology instructor. So I'm going to be doing a couple of videos on the bones. They're going to just be basic bone videos on how to identify some of the bones. Well, actually, how to identify all of the bones. So this will be 2 videos. This video is going to include all of the bones of what's called the axial skeleton, which includes the skull, the vertebral column, the ribs, the sternum, and the hyoid bone. So we're going to start with the skull, and we're going to learn how to identify the bones in the cranium and the bones of the face. The cranium is going to be the brain case, okay, the rounded part of the skull, and the face, of course, is the actual face. And we're going to keep it very basic, so just so that you're able to just identify the bone itself, okay? So if we start with the cranium, right, this is the brain case. We've got the frontal bone here on the front. This would be, your forehead. We come over to the side. We've got a bone here, and you'll have the same one on the other side, and this is the parietal bone. Here is the temporal bone. This would be right under where your temple is. Okay. And then on the back, we've got a bone here that actually goes underneath, forms part of the base of the skull, and this is called the occipital bone. Okay. Those are the bones of the cranium. There's also a sphenoid bone, which is here and in the eye socket, and an ethmoid bone, which is found also in the eye socket. It forms the roof of your nasal cavity. That's part of the cranium as well. For the face, okay, we have lots of smaller bones in the face. Let's start with the big ones. These are the 2 maxillary bones, right? This is your upper jaw, okay. The cheekbones are the zygomatic bones with a Z. The hard part of your nose is the nasal bones. There are 2 of those. There's a tiny little bone in the corner of your eye socket, and that's called the lagrimal bone. Okay, see that here. And then this bone here is the mandible. Now I'm going to show you the mandible as a separate bone, because very often on things like exams or quizzes or whatever, it's put at a station as a separate bone. So I'll just move our skull out of the way here. And this is our mandible. Okay. So this is your lower jaw. This would be like right behind your cheek. Okay. You can see the lower teeth. Okay. And that's our mandible. All right. So that's the skull. I'm just going to pull these guys out of the way. Let's talk about the vertebral column. The bones of the vertebral column. Okay. Put my sacrum somewhere here. Okay, well, first of all, let's talk about the vertebral column itself. The vertebral column is 26 bones in total. You have 7 cervical, 12 thoracic, 5 lumbar, the sacrum, which is this bone, and the coccyx, which most people call the tailbone. If you look at these 3 bones here, I have one of each, a cervical, a thoracic, and a lumbar. And you can see that there's notable differences between these. The 7 cervical vertebrae are the bones that are in your neck. Okay. So you can see they're very small. Okay. They kind of look a little bit like a happy clown face. The thoracic vertebrae are from the base of your neck to the middle of your lower back. Okay, there are 12 of those. They have what's called a heart-shaped body. Okay. And then the lumbar vertebrae are the big ones. There are 5 of these, and these are in your lower back. These are the ones that most people, if they're going to slip a disc, it's between the lumbar vertebrae. They have a big, heavy body. They're very large. And that's how you can identify those. Okay. The sacrum, all right? Used to call it 5 bones, now we call it 1. And it looks, it's a very large bone, okay? It's got a number of holes in it. It's got some roughened areas on the side, look a little bit like elephant ears, okay? This is what actually joins with your pelvic bones, all right? And then the coccyx is just that little tiny thing. Most people refer to the coccyx as the tailbone, all right? So those are different kinds of vertebrae. Moving on, we're going to talk about the ribs. So it would probably surprise some of you to know that that actually is a rib right there. It's not what most people think of when they think of a rib. This is more like what people would call like a typical rib. And this is a rib also. So in the ribs, you have 12 pair of ribs, okay? The first rib, which is this guy, which is very small, as you can see, it's literally right underneath your collarbone, okay? So the ribs start small, they get progressively larger as they go down your rib cage, and then they become small again. So this rib right here, which is what we would call a typical rib, is probably somewhere around rib number 6, 7, 8, 9, maybe. Okay. You know, if you were to see that on that one here on a quiz, you might not realize it's a rib, nor this one. So this one is in the kind of the middle of the rib cage, and then this rib over here, okay, is again small, and you'll notice it's very short. This would be there's 2 sets of these guys, and these are what we call the floating ribs. They don't even come around to the front, and they don't touch your sternum at all. Okay, in our lab that we do at Eastern, we talked a little bit about the true ribs, the false ribs, and then the floating ribs. So these are the floating ribs here, okay? And then the sternum is what most people call the breastbone, okay? And the model I have happens to have the costal cartilage that's attached to the ribs attached to it. But this is a sternum right here, okay? It's got 3 parts, the manubrium, the body, and the xiphoid process, okay? It's very flat. When you do CPR, you put your hands kind of right above this flat part of it called the body. And then the model that I'm using happens to have the cartilage, okay, that attaches to the ribs. So you'll see this cartilage. You may or may not see this on a test or a quiz in a lab. Sometimes it has the cartilage and sometimes it doesn't. And then the last bone of the axial skeleton, which people don't normally think about, is that little guy right there. And that is the hyoid bone, kind of shaped like a horseshoe. It's the only bone in your body that doesn't articulate with any other bone. As a matter of fact, it sits on top of your larynx, your voice box. Lots of muscles are attached to this bone. Muscles that help you swallow, muscles of your tongue. So it's a little bit unusual, but it's included in the axial skeleton because your axial skeleton is all the bones are basically in the center of your body. All right, so that's the bones of the axial skeleton. Now, there'll be a separate video, which will be the bones of the appendicular skeleton. And those will be all the bones of the arms and legs and what we call the girdles. So look for that one to help you identify the bones of the appendicular skeleton.